Spotting after your period can feel unexpected and sometimes worrisome, even though it's a common experience for many women. Understanding why this happens can help ease concerns and clarify when it might be necessary to seek further medical advice. Hormonal fluctuations are frequently at the root of post-period spotting. Changes in levels of estrogen and progesterone can disrupt the normal menstrual cycle. Stress, sudden weight changes, exercise habits, and lifestyle modifications can all contribute to these hormonal shifts. Certain reproductive health conditions can also lead to spotting. Conditions like polycystic ovary syndrome, PCOS, endometriosis, uterine fibroids, cervicitis, and pelvic inflammatory disease, PID, can affect the menstrual cycle and cause unexpected bleeding. Additionally, uterine lining thickening, hyperplasia, or more serious concerns like cancer should be considered when spotting is persistent or accompanied by other symptoms. Pregnancy is another important factor to consider. Spotting might occur in early pregnancy or in cases of ectopic pregnancies. Implantation bleeding is often mistaken for a light period, so a pregnancy test is a crucial first step if there's any chance you might be pregnant. Birth control methods can also contribute to spotting. Starting a new contraceptive or having a hormonal IUD can cause your body to adjust, leading to intermittent bleeding. This is normally temporary, but consulting a healthcare provider can offer reassurance or necessary adjustments to your contraception method. Ovulation-related spotting, known as Mittelschmer's bleeding, occurs around the middle of your menstrual cycle. This type of spotting can continue after your period as hormonal changes from ovulation settle down. Beyond these reasons, general health conditions like thyroid issues, infections, stress, and side effects from certain medications can influence your menstrual cycle, leading to spotting. Although post-period spotting is often not serious, it's good to listen to your body and consider the pattern, duration, and severity of the spotting. In most scenarios, occasional spotting is normal and not a cause for concern. However, if the spotting is persistent, heavier than usual, or comes with other troubling symptoms like pain or unusual discharge, it's wise to consult with a healthcare provider. Understanding your body's signals can empower you to make informed health decisions and address any underlying conditions promptly. Experiencing spotting after your period can be a common occurrence for many women, and while it might seem alarming, there are various reasons it happens. Understanding these causes can help ease concerns and guide you on when to seek medical advice. One of the primary reasons for post-period spotting is hormonal imbalance. Fluctuations in hormones like estrogen and progesterone can disrupt the menstrual cycle, leading to unexpected bleeding. These imbalances can be triggered by stress, significant weight changes, or lifestyle shifts. Reproductive health issues also play a significant role. Conditions such as polycystic ovary syndrome, PCOS, endometriosis, or uterine fibroids can cause irregular bleeding. Cervicitis and pelvic inflammatory disease, PID, may also lead to spotting outside your period. It's crucial to monitor the duration and frequency of such bleeding, especially if accompanied by pain or discomfort. Pregnancy should always be considered as a potential cause of spotting. Early pregnancy spotting, including implantation bleeding, can occur, often misinterpreted as a light period. Performing a pregnancy test can clarify this. If positive, consulting a healthcare provider is essential. Birth control methods are another common culprit. Starting or switching contraceptives can lead your body to adjust hormonally, resulting in spotting. This is generally temporary, but discussing it with a healthcare provider can provide reassurance and potential adjustments. Ovulation-related spotting, known as Mittelschmer's bleeding, might persist slightly after your period. This mid-cycle phenomenon stems from hormonal changes during ovulation. Broader health conditions, such as thyroid issues, infections, or reactions to certain medications, can also influence menstrual regularity and cause spotting. Stress or significant changes in routine can exacerbate these effects, impacting your overall cycle. While spotting post-period isn't typically a cause for alarm, it's wise to stay attentive to your body's signals. If the spotting is consistent, heavier than usual, or comes with additional symptoms such as pain or unusual discharge, a medical consultation is advisable. Tracking your cycle and symptoms can aid healthcare providers in determining any underlying issues and allow for timely intervention. Empower yourself with knowledge about your body and don't hesitate to seek medical advice if you're unsure. When you notice persistent or unusual spotting after your period, it's important to consider seeking medical advice, especially if certain factors come into play. While some spotting can be benign, there are situations where a consultation with a healthcare provider becomes essential. Firstly, if the spotting continues for several days or is heavier than what you've experienced before, it might indicate an issue that needs medical attention. Any abrupt changes in your menstrual cycle or spotting patterns without an obvious reason warrant a discussion with your doctor to rule out underlying health concerns. Associated symptoms can also signal a need for medical evaluation. If the spotting is accompanied by severe pain, discomfort, unusual discharge, or a fever, these could be signs of an infection or other reproductive health issues. Additionally, spotting that appears with other symptoms like mood swings or excessive fatigue might suggest hormonal imbalances or thyroid issues. Certain risk factors can increase the likelihood of spotting being a sign of a more serious condition. If you have a history of ovarian cysts, uterine fibroids, or conditions like polycystic ovary syndrome, PCOS, or endometriosis, it's especially important to be vigilant with any changes in your bleeding patterns. Pregnant women experiencing spotting should also seek medical guidance to ensure both their and their baby's health. If you're using hormonal contraceptives and notice prolonged or unusual spotting, your healthcare provider can help determine if an adjustment is necessary or if another underlying cause should be investigated. It's essential to listen to your body and reach out for medical advice if you're uncertain. Healthcare providers might conduct a pelvic exam, blood tests, or imaging studies to diagnose the cause of the spotting. Early intervention can provide reassurance and necessary treatment, whether it's addressing hormonal imbalances or managing reproductive health conditions. Your peace of mind and overall health are always worth prioritizing. Managing spotting after your period can be a relief with some practical approaches. Here are a few tips that might help ease the experience. Firstly, keeping a menstrual diary can be a useful tool. Note the days you experience spotting, any other symptoms, and potential triggers like stress or specific foods. This information can be invaluable if you need to discuss your symptoms with a healthcare provider, as patterns might emerge, making it easier to pinpoint causes. Hydration is crucial as well. Drinking plenty of water can help maintain your overall health and ensure that your body functions optimally, potentially reducing the impact of hormonal imbalances. Alongside this, a balanced diet rich in vitamins and minerals supports your endocrine system, which is responsible for hormone regulation. Stress management should not be underestimated. Practices such as yoga, meditation, or even a daily walk can reduce stress levels, which can, in turn, stabilize hormonal fluctuations that might be causing spotting. Similarly, getting enough sleep is essential, as it allows the body to repair and balance hormone levels effectively. When it comes to exercise, maintaining a regular routine can help regulate your cycle, but it's crucial to find a balance. Too much intense exercise may contribute to hormonal imbalances, so aim for moderate activity that you enjoy. Over-the-counter pain relievers can be helpful if spotting is accompanied by mild discomfort. However, always follow the guidance on the packaging or consult your healthcare provider for advice. Wearing breathable cotton underwear and keeping the vaginal area dry can prevent infections, which sometimes accompany or exacerbate spotting. Additionally, using panty liners on days when spotting is expected can help you feel more comfortable and prepared. If you notice that spotting often correlates with starting or stopping new medication, consider discussing this with your doctor. They might be able to adjust your prescription to alleviate these side effects. Lastly, learning to distinguish when medical attention is necessary can help put your mind at ease. Regular checkups with your gynecologist can ensure that any potential issues are caught early. Remember, you're not alone in this, and professionals are available to help navigate these concerns. By incorporating these tips into your routine, managing spotting becomes a more straightforward process, giving you greater peace of mind and improving your overall well-being.